All right. Thank you all for joining today's webinar. We are going to go through a kind of a sample analysis using the specifically the harmonized MHAS and the Gateway to Global Aging data. We do have a few people from the MHAS team also with us, so if you have particular questions about MHAS that I'm not able to answer, hopefully they'd be able to provide some more information, and I'm thankful that they were able to join us today. We'd like this webinar to be interactive, so if you have any questions or comments throughout the webinar, feel free to ask them either in the question box or the chat box. There's also a handout which is provided to you, and that's called Advanced MHAS Webinar.doc. You can download that in the handouts section of the GoToWebinar panel. And that is actually a DOC file, so that is a DO file, meaning a Stata do file. So you would just need to remove the C off that extension, and you'd be able to run that file inside of Stata. So let's go ahead and begin. So we're just going to kind of pick a research question to begin with as a way to kind of get into the data and get our hands used to working with, in this case, the harmonized MHAS dataset and the RAND-HRS dataset. So the question we're going to be asking are there country-level differences in the longitudinal patterns of disability onset by gender or by wealth? So of course, our country-level differences here, we're going to be looking between Mexico and the US. There are, of course, many countries which are included, which have harmonized data, more than 30 countries that have harmonized data. So you can compare a lot of countries, but we're going to be focusing on Mexico and the US here. And we're looking at longitudinal patterns. Both the MHAS and the HRS are longitudinal surveys, so they come back and they re-interview people. So we're going to kind of exploit the longitudinal nature of these studies and look at changes over time for a single individual. And we're looking at disability onset, so people who move into disability over time. And then we're just going to look over a couple different, kind of two different facets, two different characteristics, one being gender and the other being wealth, to see if some of these differences that we might see in the patterns are different for people of different genders or wealth levels. So the steps that we're going to go through today is we're going to download the harmonized MHAS and the RAND-HRS data. We're going to identify comparable measures in the MHAS and the HRS. We'll create a pooled data set with observations from both harmonized data sets. This is sometimes called a pooled data set or a stacked data set, meaning there's observations from both of these different studies inside one data set inside of Stata. We're going to prepare our variables. We'll have to, of course, make some changes to our variables to prepare for the analysis. We'll apply weights. And then first we're going to analyze disability prevalence across countries. Prevalence here meaning just the rate at any one given time of the number of people who have a disability across different countries. And then we're going to analyze the disability onset across countries. And again, onset here, we're more talking about something that's longitudinal in nature as we watch people move from having no kind of, in this case, we're going to be using ADL difficulties, activities of daily living difficulties, into having some kind of difficulty. So the first thing we would do is we need to download the harmonized MHAS and the RAND-HRS data. So you can download these. I have the websites here. Harmonized MHAS data that's available on the MHAS website, and the RAND-HRS data is available on the HRS website, which is part of the University of Michigan. If you would like direct links to these, I would suggest that you visit the Gateway to Global Aging data. That's available at g2aging.org. That is the website we maintain here, which is a central place for researchers looking to use these harmonized studies. On the Gateway to Global Aging data website, you can click on the Download tab here on the top right. And then you can get links to all of the different surveys. So for instance, we have here a link to the MHAS website, and we have a link to the HRS website. So this is where you would go to obtain that data first. I'll briefly just take you to the MHAS website just to navigate you through. For both the HRS and the MHAS, you will have to register. Registration is very simple for both of them, and I think you can get registered within a day. So to download the harmonized MHAS, you would want to click on Data. Let's see, click on Data here, Data at the top right here. And then once you're in here, you would want to go to Imputed and Harmonized Data. And you can get a link here to download the data file for the harmonized MHAS dataset. You'll also notice that the harmonized MHAS dataset has data for the first 3 waves of MHAS, 2001, 2003, and 2012. We will be adding the 4th wave hopefully sometime soon, but in this case it's 1 file for the first 3 waves. We also have a code book, which we'll be looking at today, which will give you more information about the variables in that data set. And we provide the data creation code, which is the code that we used to create that from the original MHAS survey data, which can be important if you want to know kind of exactly how we created these variables. So next we want to identify comparable measures in the MHAS and the HRS. And this can be somewhat of a task to find different measures which are comparable. One way to do this is to download the surveys themselves, the questionnaires, and to look through them. But we've built a search into the Gateway to Global Aging data and a couple other features which are helpful for finding these comparable measures. So briefly, if we jump back to the Gateway to Global Aging data, if you go to documentation, one of the things that you'll see is that we have many different domains here that have tables of comparability between different studies. So we're going to be looking at health, and let's just go into the summary table for health. Again, we're looking at disability, and kind of we're modeling disability using any difficulty with activities of daily living. These are also called ADLs. So you can see exactly between the HRS and the MHAS here, what are the questions which are asked consecutively. And you can see that there's actually quite a lot of overlap here in the ADL questions between the HRS and MHAS, so that's quite nice. We can use that, and of course there's many other tables, and it's a helpful place to get started. We also have a concordance search, so you could also search here. For instance, bathing is an activity of daily living. And you could search between the HRS and the MHAS, and let's say for 2000, 2001, and we can search those questions for bathing difficulty. We can get the variables there. Again, these are from the original survey. We could also search for this using the harmonized data instead of the studied data. So you could select RANDA HRS and harmonized MHAS, still 2001. And then instead of searching for bathing, we could search for all the ADL measures by clicking ADL here. And we can click search. And what we'll get here is all the ADL measures from both studies. You'll see the variable naming convention is fairly simple for these. So the first variable is either an R, an S, or an H usually. That means it represents the respondent, the spouse, or the household. The next letter represents the wave number. For the HRS, these are wave 5 variables. And let's see if we jump to MHAS variables, you can see these are wave 1 variables. You could click onto any of these to find more information also. And then, as I mentioned, we have the harmonized code books, which provide a lot of information. So quickly, I'll show you how to download the code books. If you go back to that download page on the Gateway to Global Aging data, on the 3rd row here, you can download the harmonized code book. So you can download the code book for that information. And I'll pull up here our harmonized MHAS code book. So you can see here, I'll expand it a little bit in case that is too small. So this is version A as of July 2017. And then you can use the bookmarks to the right, for instance, to select different things. And for instance, we could scroll down and we could say IADLs, ADLs. We're going to say, how about an ADL summary? So we can see we have a couple different summary variables for ADLs. You can find out more information about how that variable was created here in the How Constructed section. And we also highlight any differences between the RAND-HRS and the harmonized MHAS, or whichever harmonized document you're using currently. We always use the RAND-HRS as a kind of basis for comparison between different harmonized studies. So if you recall, what we decided to look at was disability, and we're going to model that using this 5-item ADL measure, which we saw just briefly using the harmonized MHAS codebook. And that measure is in both the RAND-HRS and the MHAS, because we saw that those questions were asked very comparably. The same questions were asked in both studies. We'll use gender, which is going to be constructed the same way between different studies. So in this case, I think 1 is male and 2 is female. That variable is the same. It's going to be named the same. We could use education if we wanted to model SES, but perhaps instead of using education, we would like to look at wealth as kind of to see whether the amount of resources that people have might have an influence on the likelihood that they would become disabled over a given period of time. So we've kind of got our measures now. So the next thing we're going to do is we're going to identify selected variables in the harmonized MHAS. And you could do this using the code books or using that concordance search that we saw on the Gateway to Global Aging Data website. So we're going to want a person and a household identifier. In the harmonized MHAS, those are UNHHID-NP and H1HHID. Oh, I should mention our years of interest here. So we want to look at something over time, right? We're going to exploit kind of the longitudinal nature of these surveys. So we're going to use wave 1 of the HRS, of the MHAS, which was conducted in 2001, to wave 3, which is conducted in 2012. So we're looking over an 11-year time difference. So for instance, for our 5-item ADL summary, we're going to want 2 variables. We're going to want both what their counts of any ADL difficulty were in 2001, and then we want to see again when they were re-interviewed in 2012 what the counts of their ADL difficulty were then. So these 2 variables are R1 ADLA and R3 ADLA. We have our gender variable. We have a household wealth variable in 2001. We have an age variable in 2001. We have an individual analysis weight in 2001 and a household analysis weight in 2001. So you'll notice that all of the kind of variables that we're going to use for the analysis or to kind of separate different subpopulations here, we're looking at 2001. And that's because we're kind of doing a prospective analysis here. So we're looking at where people were in 2001 and then looking at how they changed to end up in 2012. So in that case, we want to use the weights for 2001, and we'll look at age in 2001 and household wealth in 2001. Longitudinal analyses can be prospective or retrospective, or they could kind of be continuous and treat each year as itself, depending on what kind of modeling you're doing. Next, we'll identify selected variables in the RAND-HRS. So again, our years of interest are going to be the same, with the exception that we're kind of going to pick 2000 as our comparable year for the HRS study, and that was wave 5 of the HRS. And then both MHAS and the HRS were fielded in 2012. That was wave 11 in the HRS study. So again, we're going to get a person and a household identifier. We always want to keep those identifiers in our data sets if ever we want to merge back in with something else. We're going to use our 5-item ADL summary in 2000 and 2012. So this is a kind of 12 years difference, and that's R5 ADLA and R11 ADLA. Our gender variable is named the same, so RA gender, that doesn't have a wave number in it. Household wealth is in 2000, that's H5 ATOTB. We have the age variable, in 2000. We have an individual analysis weight and a household analysis weight, both in 2000, just as we did for the harmonized MHAS. So now that we know which variables we want in which data sets, we can go ahead and start to do some analysis in Stata and build this kind of analysis and put our data into Stata. So to do this, we're going to start using Stata now. So I'm going to open up Stata. I also might change the color scheme a little bit. Might be a little easier to see. All right. Okay, and if you remember, in the handouts we have that .doc or really .do file. So we're going to open that up. We can do this with the do file editor inside of Stata. If you're unfamiliar with Stata or don't use Stata, I'd encourage you just to follow along. A lot of the commands will kind of be similar, and certainly the steps will be similar whether you're using Stata, SAS, SPSS, or R. We do have some examples of similar analysis in SAS that we provide also. So if you're interested in those, just let me know, and I'll show you where at the end of the webinar where you can find those if you're not familiar with Stata itself. So I'm going to find this program, and I know this is on my desktop here. It's advanced mhaswebinar.do. So I can open this up. And here's the do file. If you're doing this, if you're following along, the only thing that you need to edit is these first two lines, line 6 and line 7, and you would need to say where your data is stored on your computer. So for instance, I have the harmonized MHAS data in a folder in HMHAS derived, and the RAND-HRS data here in a folder called HRS data. So I've got those downloaded on my machine. The other thing you'll notice is that there's a command inside of this data program called pause. And what that will do is once we start to run this program, it will stop at given points, just so we can look at any output this data has given us, or maybe test something that's going on inside of the data set, and we can continue to move on. So once we click run, so we'll jump up to the top here, and we can execute or do this data do file with this button here on the top right. So we can start that, and then to jump to any next step, you would just type Q and press enter, and it would jump to the next step. So I'll bring up the commands on the slides first, then we can look at the results inside of Stata, because I think it might be a little easier to see the commands on the slides themselves. So the first thing we want to do is we want to read in the harmonized MHAS observations and variables. So we're going to use this data set. That's the command to bring data into Stata. Stata kind of works by building a data set in its memory. That makes it very fast, but you pull it into kind of working memory, and then Stata plays with it from there. This is somewhat different than how SAS works, if people are familiar with SAS. So we're going to we have our variables listed here that we identified, and using the HMHAS.dta. And then we're going to generate a variable which will just tell us where these data are coming from. In this case, I'm using the 3-digit numeric ISO country code for Mexico, which is 484, just as a way to identify them. So I remember, so all these observations which occur in the data set we know represent Mexico. And then we'll read in the RAND-HRS, observations and variables. And to do this, we're going to use the append command. So what append does is that we're not using the data set again, because that would replace our current data set. And we're not merging, if you're familiar with merging, because we know that no one in the MHAS data set would be also in the HRS data set. But we're going to append, which is going to take a new set of observations, and it's going to append them or put them below the current data set. So we'll append using RAND-HRS. This is version p.dta. We're going to keep those variables that we're going to use. This command here saying keep where you list the variables you want isn't required, but it's often helpful because particularly the RAND HRS is huge. It has 12 waves of data. So of all the variables in the RAND HRS, there's 12 of them, mostly for the respondent and then also for the spouse, so 24 for every measure. It can, depending on the type of Stata you have or your computer system, it's often helpful to kind of limit the variables that you're bringing into Stata. So we're going to just keep these variables from the RAND HRS. We're going to generate a variable called Append, and that'll let us know if the observation we're looking at is coming from the RAND HRS because it was appended, or if it was already in the data set inside of Stata because it came from the harmonized MHAS. So then we can give a country code value of 840. That's the 3-digit numeric ISO country code for the US, if that append variable is equal to 1. And then we can just further kind of define our country code variable by letting Stata know that 484 is equal to Mexico and 840 is equal to the USA. This will make our results look a little cleaner. And then we want to label values ISO country, ISO country. So if we jump back into Stata, you can see that we did this. We could also tab ISO country. I'm just going to type this out. You can see that we have a little more than 21,000 observations from Mexico and more than 37,000 observations from the US. So we know we have data from both of our countries in there. So we now have our stacked data set. The next step we want to do is we're going to prepare variables. One of the things that you might have noticed about the variable names that we used in the harmonized data sets is that they contain the wave number. And this can be particularly helpful if you're just looking inside of one study. But when you want to compare between different studies and you want to consider the same years, usually studies aren't going to have the same years. So of course, 2000 or 2001 was the first wave of MHAS, where those same years, 2000, 2001, were the fifth year of the HRS. So we're going to make some new variables which are going to capture values based on the year they were conducted and not the wave. And that'll be helpful for our cross-country analysis. So the first thing we're going to do is we're going to make a variable called R2000 ADLA. And so we know that if they're from the MHAS, meaning they have the country code of 484, we're going to take the values and give it to them from the variable R1 ADLA. And if the respondents are from the US, meaning their country code is 840, we'll give them the values from the variable R5 ADLA. So we'll first do that for our baseline here, which is 2000, and then we'll also do that for when we're looking in the future, 11 to 12 years later, and we'll make a variable called R2012. Because again, what we're attempting to do here is kind of exploit that change over time of people moving from perhaps having no disability difficulties to having a disability difficulty. We'll want to do a similar thing here for both our person level weights and our household level weights. And we'll do the same thing again for the household ID. So again, this is all very simple. So we're just going through and kind of making a new variable, which the variable name is year specific, and it contains observations from both variables instead of one or the other. We can jump through, if we type Q here in Stata, we can jump through and make those. All right, so we've got those set up. We're going to create an indicator of any ADL difficulty. So I mentioned that we have this 5-item ADL difficulty, and if we wanted to go back to the harmonized MHAS codebook, so let's do that, we could find out exactly what measures are inside of that. So RDLA is the sum of 5 variables, one about bathing, one about dressing, one about eating, one about getting out of bed, and one about walking across a room. So respondents can have a score of 0 to 5, 0 meaning they had no difficulty with any of these, 5 meaning that they had difficulty with all 5 of these items, which you would imagine someone would be quite impaired then. So we're going to create an indicator of whether they had any difficulty. So while we have this range of 0 to 5, what we really want to do here is create a binary, and we're going to kind of use as our cut point having any difficulty. So we're going to do this with this command in Stata calledegen. Gen in Stata is how you create any variable. Of course, you saw gen here on the last page. Gen just means generate or create a variable. And we're going to use thisegen, which is an enhanced generation, and it allows you to do a few extra things. So for instance, we're going to create a variable called r2000 any ADL. And we're going to say we're going to cut the variable r2000 ADLA. That's the variable we created earlier. And our cut points are going to be 0, so that's the beginning. We're going to cut at 1, so meaning anyone who is at 0 is going to be one group. And then anyone who is 1, in this case through 6 or through 5, is going to be another group. And then we use this icode command just to say give these the values of 0 and 1. So we create both of those, and then we're going to create an indicator of whether able individuals experienced an onset of ADL difficulty. And again, we're kind of ADL difficulty here is our proxy for disability. So we're going to gen a variable called r2000 any ADL x here for change, right? So we're going to look at people. We want to just look at people who we know didn't have any ADL difficulties or no disability here in 2000, who then transitioned at some point by 2012 to having some, at least one ADL difficulty. So we're going to assign a value of 0 if the person didn't have, again, we established at the baseline there was no difficulty, and then when we came back, when we followed up 11 to 12 years later, they still didn't have a difficulty, right? And then we're going to assign a value of 1 if we know at baseline they had no difficulty, but then they followed up when the follow-up happened 11 or 12 years later, they did have a difficulty. You might notice here that we are leaving out anyone, of course, who had a difficulty in 2000. We're not really looking at them. So further analysis might be wanting to look at, so exactly who are people who had a difficulty in 2000, who maybe still had a difficulty in 2012, who were still inside of our sample. The other thing that we're doing here, which might not be as obvious, is that anyone who wasn't interviewed both in 2000 and 2012 would not have a value for this variable. So this variable, which we're going to be using, captures what's called a balanced sample, meaning that it only includes people who were in both waves of our analysis, so both in the 2000-2001 interview and in the 2012 interview. So of course that's going to exclude a lot of people. People can drop out of the sample for multiple reasons, and we'd really want to look at, particular if we're going to kind of do a more thorough analysis, we want to look at who's dropping out. Whether there's higher levels of ADL difficulty in 2000 for people who dropped out than people who stayed in. That could really bias some of our results. Of course, some people are going to drop out because of death or sickness or not being able to follow up. So we'd really want to get an idea of who didn't make it to the 2012 survey to know how that might bias our estimates. We're not going to do that here, but I want to mention it because that is an important aspect to doing longitudinal analysis. We'll jump back into Stata if you're following along. And we'll jump through. So the next thing we're going to do, this is slightly more complicated. You can see the code here, it looks longer. Don't be stressed out by it, but I would like to mention it because I think it's a common thing that people want to do with harmonized data sets that requires a little more work than maybe people see on the surface. So we want to create, in this case, wealth tertiles. So we'll have a group inside of each country of low wealth, middle wealth, and high wealth. So we're separating our sample by wealth, and again, we kind of want to see whether disability onset has some kind of relation to wealth, the amount of resources that a household might have. So the first thing we do here is we create a household tag. And in Stata, a tag here just means we're going to get a value of 0 or 1 or more zeros, but you get a value of 1 for each individual household. So both the RAND HRS and the and the harmonized MHAS are individual level. So each record is one individual. But inside of both surveys, there are questions not just about the individual. Of course, things about the individual might be someone's gender, their ADL difficulty, perhaps their income. That's usually an individual measure. That's not something you ask about multiple people or a household. But wealth is something that usually we measure at a household level. So there is a report, for instance, in the HRS survey, they just choose one respondent. This is called a financial respondent, and they say, for you and your spouse, which we're referring to here as a household, what is your, they go through all different components of total wealth, but they basically ask, what is your total wealth? But what this means is that because we have a data set which is individual level, that if you look at a respondent and a spouse together, you would see that they have the same value for wealth inside of the data set. What we don't want to do is to create a descriptive statistic about household wealth where we count both of those different values for the same household as two different households. We want to make sure that we're only looking at a household level here. So we do that by using this tag. So we're going to get a variable, which is in this case going to be called H2000 HH tag or household tag, which only gives a value of 1 to each individual household. In the tag command here at the top, you can see that we have tag, we have our combined year-specific household ID variable, and we added the ISO country code. We do that just in case the household IDs are perhaps overlapping between the RAND HRS and the harmonized MHAS, and we want to make sure to keep them separate. So we can do that by adding these two variables inside of the tag command, which basically says to treat all the tags separately for separate observations with ISO country code. And then we're going to create wealth tertiles. And again, this is a little more complicated, so I'm not going to spend too long on it. If you have follow-up questions about this, I'm happy to answer them afterwards. But we're going to be using a variable called xtile. Because we're using two countries, of course, the harmonized MHAS is in pesos and the RAND HRS is in dollars. And there's a lot of differences between what it means to have a certain number of pesos and a certain number of dollars. So we're going to create these separately for the MHAS and the HRS respondents, and then we'll combine them at the end. So first for MHAS, we'll create a variable using xtile, where we make sure that we select only if we have the country code of 484, meaning from Mexico, and we have a household tag of 1. So we're going to ignore those observations, which are kind of duplicates inside of the harmonized MHAS for the spouse of the respondent, because both the respondent and the spouse would have their own record. We're going to use our household weight here. Again, that's why we brought in that household weight. And we're going to say we want to split it into 3 sections. And the next thing we're going to do is we're going to make sure that we copy the value that we have given for whether they're in the first, second, or third household wealth group to the other person if they have a spouse. So we do that using BySort, our household ID. And we're going to replace the household ID if it's blank with the one that is, in this case, that is below it. And then we'll do the same thing for the HRS data sets, HRS observations, and then we'll combine them together. So we'll take again, just like as we did before, we'll take the _M observations if they're from the MHAS, the _H observations if they're from the US, or from the HRS. So we have one variable now called H2000 ATOT _T, which tells us inside of each country whether they are low, middle, or high wealth. That is the most complicated part of this sample analysis, so don't worry, nothing's going to get terribly more complicated than that. Let's also create an indicator of age cohorts. Again, we're going to use thisegen kind of cut command. And it might just be helpful to look at if there's changes for different age groups. And we'll use 5-year age groups here. Again, since we're looking at age in 2000, we want to remember that we're looking at people's age at the baseline, but these are also people who were followed up 11 to 12 years later. So we're going to keep our ages kind of low here for age of 2000. So in this case, we'll look at people who are 55 to 59, 60 to 64, 65 to 69, and then we'll put everyone else who is 70 or older in 2000 into this group between 70 and 110 into our kind of fourth group there. And then we're going to create a flag for our analysis sample. This will be helpful because then we can just say, just remember the people who are in our sample here. So the people that we're going to include are people with the age categories of 0, 1, or 2. So these are people who are 55 to 69, so those 3 age groups. And people who are not missing, they don't have a missing value for the variable that we're really considering, which is R2000 INI ADLX. And this is important. Again, we want to make sure we are aware of who we're dropping out, right? So we're not considering people who are 70 or above in 2000. We're not considering anyone who was not followed up 12 years later. We're not considering anyone who had any ADL difficulty in 2000. So it's a narrow analysis, and we want to make sure we know how we've narrowed our analysis. And for a more thorough kind of research, we want to look at exactly who are we leaving out, of course. Let's jump back into Stata. So we've got our age cohorts variable there, and we'll also create our sample analysis. One thing we might do is want to check on our sample sizes. So let's tag our sample variable, or tabulate our sample variable by our ISO country variable. So you can see that inside of the MHAS respondents, we've got 3,800 inside of our sample. Inside of the US, we've got 6,000. Another thing we could do is we could tab a variable like gender and only look at if people are in our sample. So tab RA gender, ISO country, if sample is equal to 1. And we can get an idea of, do we have enough males and females to kind of make interesting predictions? And of course, you might notice that there's a difference in sample sizes. So it looks like on average we have, some bit more, not quite double the number of respondents in the US as we have in Mexico. But to me, here looking at this, I think there's good sample sizes for all, in this case, of these 4 groups. So next we're going to apply weights. And one of the helpful things about using Stata that makes me enjoy Stata when I analyze survey data like the HRS or MHAS is they have a lot of built-in commands for using survey data. And one of them is called SVY set. And what that does is it's a way to tell Stata exactly how this complex survey is set up. So for instance, we can tell it how the data is weighted. So we use here our combined weight. And then we can also tell Stata things about how the sample is stratified or clustered. In this case, we're just going to say that our strata here are a country level. So our sample is going to be the weights refer inside of each strata here, which we're going to use as our country code, just so Stata doesn't know that the weights for the HRS are not overlapping with the weights for Mexico, because we kind of want national level estimates for both of these countries. Once we type in this SVY set, we can then, we don't have to specify these things for every single analysis command that we make from here out. Stata will recall this information. So let's do this inside of Stata. So we'll type this. The other thing you can see that we can do is we use this command called SVY describe. And so to describe our sampling, you can see that we have 2 strata here, a stratum of 484 and a stratum of 840. Again, that's the US and Mexico. So that is perfect. So I think first in my analysis, before we kind of look at any longitudinal changes, it might just be good to look at prevalence. As I mentioned, we might want to just look at prevalence in 2000 or 2001 between these two different countries. So we can estimate disability prevalence in each country for all people in our sample. And first I'll show you how to do this in kind of two different commands, and then you can see below here there's kind of a simplified command where you can estimate it all together. But I think it's helpful to look at them separately first. Inside of Stata, again, to recall that SVY set information, that information we gave Stata about how our survey design was set up and how we want our estimates weighted, we're going to say SVY, that tells Stata to recall what it was already told. And then we want to set the subpopulation condition. And this is extremely important inside of Stata to get kind of corrected errors. Is an important thing. Often standard errors using survey data can be a little off, and so if we set our subpopulation, so we can say if sample is equal to 1, so if these people who are in our sample, and first we say if we're going to first generate an estimate for Mexico and then an estimate for the US, this lets Stata know which standard errors are applicable to this and which ones they should ignore. Some people would do this by using an if command after the actual command. They would say the mean of the variable after the command. This doesn't allow Stata to estimate the standard errors correctly. So this is the correct way to get standard error estimates outside of Stata. So let's jump into Stata and actually do this. So first, we estimate our sample for, let's see, one shot emitted. I wonder if I type Q here once more. All right, it looks like I'm getting a tiny bit of an error. Not totally sure why. Our standard errors, let me see if I can, any ADL, because I've typed this slightly wrong here. So instead of SVY subpop mean ISO country 2000 NEADLA, so let's just make sure that our variable has some values. Again, we're getting a 0 here, which is slightly odd. So we do have values there, and then we can get a mean of this variable, R2000 NEADLA, or just ADL. One more 0 there. All right, so that's our value for the whole one, which is less interesting. Then we can also do this if ISO country is equal to 484. So that's our prevalence estimate. Again, this is not a weighted prevalence estimate yet. We'll get to that. That's for the MHAS for Mexico. And this is for the US. These are sample estimates because we haven't put in our weights. And then we should be able to also apply our weights. What you'll see is that our disability prevalence by country here, for Mexico, these are weighted estimates now. We're just looking at this visually. It looks like the prevalence rate is actually quite higher in the US for our sample. So again, these are people who are, if we remember, 55 to 69 and are both interviewed in 2000, 2012. It looks quite higher for Mexico than the US. So that's good to keep in mind. But again, we want to kind of exploit the longitudinal nature of these surveys. So we're going to be looking longitudinally. So we want to estimate disability onset. And remember, we made that change variable. That change variable which looked at people who moved from having no ADL difficulty to having an ADL difficulty. Briefly, I will just mention, all right, so I showed you that you could estimate them separately, but you can also estimate them in a single command. And this will come back later. So we can still say SVY subpop if sample is equal to 1, and then the mean of R2000 NEADL. And then instead of specifying each country, we can use this option here of over ISO country. And it'll say for all the values that are in our data set of ISO country, it'll produce an estimate for each of those. Again, we have 2 values for ISO country, either Mexico or the US. So we'll get values for those. So the next thing we might want to look at is disability onset, again, that longitudinal nature. So this command is going to look exactly like the command that we had before, except that instead of the prevalence rate of ADL, we're going to look at this, the change rate of ADL. Again, we keep everything else the same. We're going to say that over ISO country. So here, this is working here inside of Stata, thankfully. So you can see that we get to estimate inside of Stata both for Mexico and the US. For Mexico, we would estimate that of the people in our sample, again, keeping all our conditions in mind, that around 17% of them would experience some kind of ADL difficulty moving to a state of disability through ADL difficulty over that 11-year period. And for the US, 13%. You can also see we have these 95% confidence intervals. And this is helpful to know if this is really kind of a meaningful difference or not. It does look like there actually is a slightly meaningful difference. We'll talk about how to test those estimates also, to whether we can know whether there is a statistically significant difference between these two. If we look at this graphically, of course, you can see what we saw before in our Stata results, which is that Mexico has a slightly higher rate, although they are fairly close together. And it does look like they might be a little bit statistically significantly different, but we could test that. So again, we want to set, we might want to look over ages. We're going to look over gender and wealth. I know I mentioned that at the beginning. But let's also look over our age cohorts just to see if there's kind of a different pattern happening between our 5-year age cohorts. Again, we're going to keep the same basic command, so you might be seeing why Stata is really helpful here. The only thing we're going to change is instead of saying over ISO country, we're going to say over ISO country and our age categories. And what that's going to do is it's going to give an estimate for Mexico, people who are 55 to 59, Mexico, people who are 60 to 64, and Mexico, people who are 65 to 69. So you can see that we get those estimates here. We get a mean for each, a standard error, and a confidence interval. It's slightly easier, especially for a webinar, to look at this graphically. You can see we also have the 70 plus population here, which I wouldn't consider as much because we want to make sure that these people are, people who are 70. It's kind of a selective group of people who are still living to 2012, 70 to this is 110 in this case. But of the first year, the gradients they look a little more, to me at least, a little more even inside of Mexico than they do in the U.S. It looks like the gradient kind of continues at a more continuous slope inside of Mexico. But in the US, it looks like people stay fairly same, 50 to, in this case, 64, but then it tends to jump quite a bit at 65. So now let's look over gender. And here we'll test the differences in the estimates. So we can estimate the rate of disability onset in each country by gender. Our command's going to look exactly the same, except instead of saying ISO country age groups, we're going to say ISO country gender groups. This over command would allow you to put create many subpopulations. So you could say, you can look over countries, gender, age. Also, you can keep on adding them in there. One thing when you want to do that though is you want to keep in mind what your sample sizes are. So we're going to look just over country and gender. So we'll do that inside of Stata. And then we get an estimate, of course, 4 estimates here. One for men in Mexico, women in Mexico, men in the US, women in the US. But let's test the difference between these, and we can do this inside of Stata. So the command for this is called a post-estimation command. So you run this command after your estimate. So we create our mean here for our 4 different groups, our estimates of the mean. And then we're going to test the difference between men and women in Mexico. So if you recall inside of Stata here, we could see that subpopulation 1 was Mexican men, subpopulation 2 was Mexican women, subpopulation 3 was men from the US, and subpopulation 4 is women from the US. So we can test the difference between men and women in Mexico and test the difference between men and women in the US to see if there's a difference. And then really what we want to see is maybe there's a difference we're seeing in the US which we aren't seeing in Mexico. This is called a difference in difference approach. And this is often what people use when they're using these kind of cross-national studies for cross-national comparisons. Again, it's somewhat mildly interesting to say something like, well, there's slightly higher but not statistically significantly different disability onset between Mexico and the U.S. But there's a lot of things that could be driving that, and it doesn't really speak to all the differences between Mexico and the U.S. and these samples itself. But it might be more interesting to say, I see a gendered pattern in Mexico or in the U.S. that I don't see in the other country. So you're comparing the difference between two different countries or many different countries in whichever analysis you're doing. So if we jump back into Stata, we can see our results here. So first, if we test the difference between women in Mexico, well, first let's look at it. So we can see that in both countries, women have slightly higher disability onset rates. You can see here that we have plotted our confidence intervals, and yeah, it looks like they both have higher, but whether they're statistically significantly different is maybe a little less clear. If we look here at our results for Mexico, if we say to Stata test these difference between our estimate for subpopulation 1 and subpopulation 2, Stata performs an adjusted walled test. And we get a probability greater than the F statistic of 0.19, so we would consider that not a statistically significant difference. We could also test the difference between the US, and again, we would consider this not a statistically significant difference. One thing that you might want to notice here on our results, and you can see this also also in the graphic results, is that our standard errors for the MHAS data are about double what they are for the US data. And this could be due to different things. Of course, we know that we have more of a sample size, a higher sample size, a greater sample size for the US than we do Mexico. So that could be driving some of that difference. But there could also just be more variability inside of the Mexican data that gender is not explaining than the US data. So we're not able to kind of talk about that difference. But we can say, graphically, to me, the difference looks about the same level, and they're not statistically significant difference in either country. We know we tested that. So we're not really seeing a gender difference in the differences in different countries because we're not seeing a gender difference in either country. And as our last step, let's look by wealth. So again, this is going to look really similar. In our over command, instead of saying ISO country RA gender, we're going to put in our wealth tertile variables. So we know we have 3 wealth tertile variables for each country, so we're going to get 6 estimates, 1 for each country, 3 for each country, and then we can test that difference. So we jump back into Stata, we can type Q. Here we get our 6 estimates, so it goes from low wealth individuals in Mexico to high wealth, that's subpopulation 3, and low wealth individuals in the US to high wealth individuals in the US, that's subpopulation 6. We get estimates for all of these. If we look at this graphically, of course we can see what we might expect, which is that people at low wealth in both countries do experience higher levels of onset disability by country. If we look at kind of the different gradients, to me, they look a little bit different. You could test this more formally. But one of the things you might notice is that low wealth people in the US are estimated to have a higher disability onset than low wealth people in Mexico, and high wealth people in the US are estimated to have a lower disability onset than high wealth people in Mexico, meaning that there seems to be a lot more wealth-based variability inside of the US. It also interesting looks like inside of the US, both middle and high wealth people, they're much more similar to each other than they are to low wealth individual. It seems to be quite a large jump for the low wealth group, where the gradient looks a little kind of a little more standard between all three groups inside of Mexico. One of the things we could do is we could test the difference between the lowest wealth group and the highest wealth group in Mexico, and the lowest wealth group and the highest wealth group in the U.S. Again, to see if kind of there's a difference in the different countries, different contexts. If we do that inside of Stata, we can get our results here. So for Mexico, we look at the difference between the estimate for subpopulation 1 and subpopulation 3. We get the our p-value here of 0.2221. Again, we would consider that not statistically significantly different. Interestingly, for the U.S. sample, we get this p-value of 0.000, meaning that we actually are wealth does seem to be a statistically significant marker here of whether people are experiencing disability onset. So again, we do see a difference here between these different ones. I think one thing we might want to keep in mind, of course, is our standard errors. You can see back on our graphic that the standard errors again are much larger for Mexico than they are for the U.S. But to me, it also does look like, at least informally, that the gradient is quite higher. There's much more deviation between the low wealth group and the high wealth group in the U.S. In the estimates, let alone testing the statistically significant difference in those estimates in the U.S. than there is in Mexico. So that's going to kind of wrap up our sample analysis. If you have any questions or comments, you can visit us at g2aging.org. You can email us at help@g2aging.org. We have a help desk. We always try to get back to your questions, whether you're using the harmonized MHAS or any of the other harmonized data sets, or if you have questions about what are the variables contained inside, what seems important to you. If you're having trouble finding something or getting started, we'll certainly be there to help. I'll also mention briefly that the slides and a video recording and the Stata code from today's webinar will be available on the Gateway to Global Aging Data as of tomorrow. In case you'd like to review this later, or you have any colleagues you would like to send this to, you can find this on the documentation page of the Gateway to Global Aging Data under recent presentations. So you'll see here that we will add a recent presentation for today. That should be up by tomorrow once we get everything uploaded. So you can find that there. And then also, if you're interested in kind of a SAS example, not exactly similar to this, or not exactly like this, but similar, I have examples for kind of doing a similar analysis inside of SAS, and I can put that up here in the recent presentations also. So I'll add that by tomorrow. Thank you all for joining us for today's webinar. I hope that it was helpful and informative. We're really excited to have this kind of completed version of the harmonized MHAS available for people. It's a really helpful resource, and both the MHAS team and our team here at USC put a lot of work into making sure that it's helpful for people who want to do these cross-study comparisons. So at this time, I'm happy to answer any questions, or I think the MHAS staff that we have here are available to answer any questions also. Again, you can do that by using the chat window and asking a question there, or posing a question in the question box, and you can ask a question. If you'd like to just speak with us, you can also raise your hand, and I'm happy to unmute you, and you could ask a question that way. And I'll hang out here for as long as there are questions. But if not, yeah, thank you so much for joining us today.